We recently learned in a joint investigation with Clark County Public Health that some patients from PeaceHealth Southwest Medical Center could have been exposed to hepatitis C virus during a hospitalization stay in the past. We don't know if that has in fact occurred, but we are here to care for patients, and when we are aware of a possible risk or possible exposure, we are acting with great caution and working closely with Clark County Public Health to investigate and to make sure that if there has been any exposure, that we inform patients who could have been exposed and ask them to be tested at our expense. So we would like to take care of them if we believe that to have possibly occurred. We feel very sadly and apologize for the anxiety that this could cause people in our community and our former patients. And again, we're here to care for patients, and that is what we're here to do. And so it's because of that obligation and that commitment that we will continue and complete our investigation with Clark County Public Health and make sure that anybody who could have been exposed gets tested and treated. That's where we're at. That's what we're working through. Our investigation is active, and that's our commitment. We're here to serve patients, and as we complete the investigation, we'll move forward to make sure that anybody who needs to be informed is.
So I just want to add, Clark County Public Health has been working really closely with PeaceHealth Southwest. The investigation is ongoing. We think the risk is really pretty low. And at this moment, we really don't have evidence that there has been an actual transmission of hepatitis C at PeaceHealth Southwest. But we're really using an abundance of caution to really go through the investigation, look at any potential exposures. We're going to go through lots of records to look to see if anybody might have been exposed. The investigation is ongoing, so I don't have a number for folks at this time, but we're going to be working really closely. We want to make sure that everybody who might have been exposed, and I use the word might because we believe the risk is pretty low, but we want to make sure that anybody who might have been exposed gets notified and has opportunity to get tested. We also don't want to notify anybody who was not exposed and create undue anxiety. So we're really working on the investigation, refining the list, and making sure that anybody who needs to get tested has an opportunity to get tested. Again, the risk is really low, and we're still working on the investigation, and PeaceHealth has been a great partner in working with us on this investigation.
Okay, with that, we'll be happy to field any questions that you may have.
How did you know that there was a possibility that this could have happened if the risk is so low?
There was one case of hepatitis C, and hepatitis C is a fairly common infection. One case of hepatitis C with no other that we could identify any risk factors, but just one case. And we actually worked with the hospital to look to see whether there was any risk that we could find, and really weren't able to find any significant risk of exposure to other folks until more recently we learned about this issue around diversion.
So we are in the course of our investigation. One of the possible transmission sources could be any employee who could be diverting drugs that work in the hospital. So in the course of our investigation, we identified a former employee who might have been diverting drugs. We don't know for sure if that is the case, but the possibility exists, and therefore that's the abundance of caution that Dr. Melnick referred to. We want to be careful of that. We want to complete the investigation and make sure that if there were any possible exposures there, that we follow up on that.
And the reason I said the risk is low is we've been actually going through all the reports of hepatitis C that come in because it's a notifiable condition by Washington state law. And we haven't found, other than that one other case, we haven't found any other case that we could tie to exposure at PeaceHealth Southwest.
Dr. Melnick, are you referring to the one instance being the former employee?
No, I'm referring to a patient.
So we're talking about
the former employee being the initial point of contact.
I'm sorry, what was that?
How did it come about that the initial contact was a former employee that you were looking at?
We don't know that the point of contact was that former employee. We just know that we have a former employee more recently we found out might have been diverting drugs.
We don't know if there's a link, but because we want to be careful, and so we are being cautious in making sure that without knowing whether there was a link, that we're making sure that we're notifying people if there's any possible risk. So we don't know if there's a link, but we're completing our investigation on that.
What's the time frame from the start, so the former employee left in March? What's the time frame you're looking at if somebody would have been a patient here?
Go ahead.
Since we know that this employee was diverting, we'd probably be looking at the entire, again, we don't have any evidence that this employee exposed anybody, but we'll be looking for the time that they were employed.
Which was, what time frame?
So the employment range was from middle of 2012 to just recently.
Can you tell us what job this former employee had?
We've got to complete our investigation into all the different components of it, and I think once we get to that point, we'll be able to follow up the information. Part of it we have to be sensitive to HIPAA concerns and privacy concerns as we complete the investigation.
Can you say a general time frame on when that one patient was here?
That patient was here back in August of 2012, but I really want to remind folks that we have no evidence of any link, of any exposure, we don't have any evidence that the employee that we're talking about caused the exposure of that patient.
Is that the August 2012 timeframe, is that when the diagnosis was made with that particular patient? Or was it
Later on, it was later on in 2012.
You said the former employee was doing what drugs, it's hard to understand you?
Yeah.
Diverting drugs, which is stealing drugs that were for patient use and taking them for personal use is basically what drug diversion means.
Was that former employee fired?
I can't speak to that at this time.
Is it?
This is Christian Fodenvest on the phone. Can you just explain how diverting or stealing those drugs possibly lead to an to hepatitis C infection? Is that because they're sucking it out with a needle and then putting in their own drug and using that needle again? Can you explain that for us?
Yeah, I mean, there's lots of different ways that that exposure can occur. One is by taking a drug yourself and then using the same syringe to give whatever's left of the dose to a patient, or contaminating some other piece of equipment that the patient gets exposed to.
And again, we don't have evidence that this occurred. We don't know if that occurred here. We do not have evidence that it did. But we're concerned that there might have been drug diversion activity. We don't know if there was, but on that concern, we're being careful and wanting to make sure that we care for anybody who is possibly exposed. And so that's why we're trying to make sure that we've identified any potential exposure, bring people in who might have been exposed and see, but we don't have evidence that any of those things did occur.
So is it wise then for people who were at the hospital between March of 2012 and, as you say, recently, to be on the lookout for signs and symptoms? And if so, what should they be on the lookout for?
So one of the things we want to make sure is that the people who might have been exposed get notified, and we don't want to create undue anxiety in the people who are not exposed. So that's why we don't want everybody to start worrying about it right now. Most people with hepatitis C don't have symptoms. Certainly, if you're concerned, you can talk to your doctor about it, but what we're trying to do is get a list of anybody who might have been exposed and get information to them directly, and that's what we're doing in our investigation.
Is it centered towards like patients who maybe have gone to the ER or had blood work done at the hospital? Have you guys even narrowed it down that far yet?
Go ahead.
Yeah, what we're looking at is anybody who might have been, in the ways we discussed exposure in terms of diversion, looking at anybody who might have been in a place where they could have been exposed to a situation where somebody was diverting drugs.
Meaning where or what?
You know, right now, because the investigation is ongoing, we're still determining where the possible locations were, and we're still working on that. So I don't want to give any information out too soon in terms of what that might be.
Doctor, can you talk about
Well, generally with diversion, they're scheduled substances, so things like narcotics, for example. That's generally the problem.
So if patients were receiving a morphine drip at the time,
That would be one possibility, yes. And we're,
being brought against this employee criminally right now from the hospital.
We are working on the investigation and don't have anything on that part at this time.
and again, I want to emphasize what I said earlier. We have no evidence that this former employee actually did expose anybody to hepatitis C. So that investigation is ongoing. I don't have any information on that yet.
Without giving a job title, is this a employee that had direct contact with patients?
I think for drug diversion to be a possibility, it would have to be somebody who has contact.
Yeah, this person was in a position where somebody could have been exposed, basically. And, we're trying to respect the privacy. Again, we don't have any evidence that this person actually caused the infection of somebody else. And we're really trying to respect privacy until we can get some more information on that. And that's part of our investigation.
Is it difficult to get that investigation and that information if, as you say, the majority of people who have hepatitis C don't even know it? Could there be a bunch of people running around right now that have it and are infected but do not know it, thus making your investigation that much more difficult?
That's going to be part of our investigation. So what we will do is, once we formalize a list of anybody who might have been exposed, and we want to make sure we don't miss anybody. We want to get a complete list of anybody who might have been exposed. We're going to be sending them a notification letter, and we want those folks to get tested. So we want to identify the vast majority of people with hepatitis C could be walking around and not aware that they have it. So we want to make sure that those folks get tested. But we want to make sure that everybody who might have been at risk gets tested. So we're going to do due diligence in compiling that list and making sure we notify the people who need to be notified.
Mr. Johnson, has anything changed in the hospital in terms of policy to prevent something like this from happening in the future?
We have been working closely with Clark County Public Health and working to verify that our practices are consistent with the highest standards, and our evidence is that that is the case. We have strong practices and policies and procedures related to this. But as we complete this investigation, if there's anything we identify, we are taking further action.
But I want to add to that, we don't even have any evidence that this happened in the past. So we don't have any evidence that transmission occurred at PeaceHealth Southwest. So when you say to prevent it from happening in the future, we've taken a look at PeaceHealth's infection control practices, and they're good. So there's no evidence that, we still don't have evidence that there was transmission. I just want to make sure we get that point across.
I guess I was referring to the drug diversion.
Yes, I mean, I think to Dr. Melnick's point, there's always opportunity for continued improvement, and we're taking that opportunity with this investigation to seek any opportunities and any way we can get better. But we don't have evidence that any issues have occurred. Our investigation suggests that our practices are very strong, yet we are going to continue to try to improve those if there's things that we identify.
Is this former employee cooperating with you guys in the investigation this time?
In terms of the public health investigation, this employee has cooperated so far.
Mr. Johnson, when did this first come to your attention?
We have been working just in the past few weeks closely with the Public Health Department on this investigation related to this possible drug diversion.
So
Well, the hospital-
3 weeks, 5 weeks?
In a couple weeks.
It's been a few weeks. I'd have to take a look at the exact date.
Will the hospital pay for treatment if someone is found to have hepatitis C?
For those patients, if we discover through testing anybody a direct link between hepatitis C and the hospital will take care of those patients at our cost.
We were hearing there might be possibly a phone bank set up for people that, I'm sure there's going to be a lot of people out there who have questions. Are you guys still doing that? And if so, is that launched already?
We expect to have a phone bank set up tomorrow because we do anticipate that there will be questions people have. And so tomorrow morning we'll have that set up and be able to field people's phone calls.